Now, it's always a nice moment when you're chairing a conference and you see that your next speaker has turned up. That always makes me feel a bit better. And I'm delighted to say we have Ken Skates here as the Assembly Member and Cabinet Secretary for Economy and Infrastructure. Ken, thank you very much for sparing the time to come. And do come up and join us, or come up to the lectern and tell us a thing or two. We're very pleased to have you. Thank you for sparing the time.
Thank you. Thank you. It's a real pleasure to be able to join you this afternoon at this incredible venue. Just over 2 years ago, I stood in this very spot and outlined how the arts had helped me to overcome a period of depression and anxiety. And I'm very pleased to be back here today to talk about the value of the arts in terms of helping older people become more connected to the people and the communities in which they live. I'd just like to outline at the outset the vision that sits behind not just the strategy that I am responsible for developing, a prosperous and secure strategy, but also the 4 overarching cross-cutting strategies for Welsh Government and the purpose behind them. We'll have 4 strategies: prosperous and secure, and united and connected, ambitious and learning, healthy and active strategy. But all of them will meet the objectives of improving the wealth of the nation in the aggregate and also well-being of the nation in the aggregate. But significantly, they will also challenge inequalities in both, with the aim of reducing the gap in wealth between the poorest and the richest, and also reducing the gap in terms of well-being. Only then will we be able to build a country that is more at ease, united, that is more connected, and that can look to the future with a greater sense of optimism. Now, within the strategy that I am personally responsible for, the prosperous and secure strategy, I've outlined my intention to move from 9 priority sectors for across Wales to 3. 3, if you like, national foundational sectors. 2 of those could be place building and health and care. Health and care in particular, because it then complements the united and connected strategy. We do need to do more to ensure that the quality of care in Wales improves, that people who have felt isolated and lonely do not feel so in the future, and that we enable people to live longer and to be active for longer in their lives. In terms of place building, I think many people immediately assume that this is about building roads and railway lines, but it's also about culture, because places that don't have culture might as well be empty vacuums. What really matters is not just how people are connected physically, but also how people are connected emotionally. And so as part of that national foundational sector of place building, I intend to ensure that the strand of culture is apparent in everything that we do. In terms of the current programme for government, Taking Wales Forward, we do recognise the value of the arts and the benefit that the arts can have to older people in our communities, and the complementary role that the arts can play in helping to change our healthcare system from one that is focused on the treatment of illness to one that promotes wellness. And other more specific objectives flow from this. For example, it's our aim to take action to make Wales a dementia-friendly country through developing and implementing a new national dementia plan. And we're also aiming, as Sarah outlined, to develop a nationwide cross-government strategy to address loneliness and isolation. Research and experience show us that the arts, in all of their forms, can be highly beneficial for treating and helping older people who may be suffering from depression, from a lack of mobility, or dementia, or other complaints that become more prevalent as we get older. The arts are also highly effective in delaying the onset of conditions so that we remain healthier for longer. There is a huge amount of activity going on in this field. As you'll have already heard today, we have a growing number of projects, programs, and initiatives targeted at improving the well-being of older people. This includes art therapists, cultural programs in hospitals, and programs in the community. And improving people's well-being has become a major priority for us in Wales. The Wellbeing of Future Generations Act from 2015 has provided new impetus to this. It sets out a range of challenges, not just for government, but also for a range of other stakeholders. In particular, the Act places a duty on us to meet our wellbeing goal of a healthier Wales in which people's physical and mental well-being is maximised, and in which choices and behaviours that benefit future health are understood. The Act also requires us to work better with people, with communities and each other, and to look to prevent problems in the first instance, and to take a more joined-up approach. Of course, local authorities and health boards have a crucial part to play. As I've set out in my vision for culture in Wales, Light Springs Through the Dark, I want to encourage all local authorities and their public service boards to develop local strategies for arts and culture. These should include clear plans and objectives for how the arts can help to improve the health and well-being of the local population, for people of all ages and mobility. Such strategies can be a framework for cooperation in which individuals, organisations and institutions can achieve more together. Already, we have some fine examples of how this kind of collaborative working is taking place. Those of you who were in here this morning will have heard about Lost in Art, which I think is a great example of partnership working between the Arts Council of Wales and my own local authority of Denbighshire. Another good example of the partnership working taking place is the Dementia and Imagination Project, and this explores the impact of art on people living with dementia and on their carers. The project draws on expertise from no fewer than 6 universities, 4 national and 7 regional organisations from right across England and North Wales, again including Denbighshire Arts Service, Rhyth and Craft Centre and Bangor University. And the research will help us to assist in considering the outcomes for communities as well as individuals, and to demonstrate the wider economic and social value of arts interventions. Another great example is the Creative Communities Project, which provides opportunities for adults with mental health problems to access high-quality arts activities. This project is funded by Carmarthenshire County Council and Hywel Dda Health Board, and it's facilitated by Arts Care Gofal Celf, a member of the Arts Council of Wales's portfolio and a charity with over 20 years' experience of delivering the highest quality projects with and for people of all ages, backgrounds and lifestyles. Now, the UK does have an ageing population. Many older people in Wales experience multiple disadvantages relating to health, deprivation, isolation, and ageism. Such disadvantages are not only debilitating in themselves, but also act as barriers to participating in social and creative activities that protect good mental health and well-being. As a government, we recognise that the vital contribution that older people make to society, including, in many cases, the role they play in caring for others. As people live longer, we need to work even more closely with communities to support our ageing population to remain as healthy as possible. There is a growing evidence base on the positive impact that the arts can have on the health and well-being of older people. Increasingly, social and medical research is demonstrating what I think it's fair to say practitioners already knew, that the arts really are good for you. There have already been some encouraging findings about the impact of the arts on aging. In particular, evidence is emerging that singing can have a positive impact on mental health and on well-being. Benefits to breathing can also have a positive side effect in reducing levels of anxiety. Perhaps that's why so many people in the past benefited from attending church. Now, ignoring the religious context, I don't think there's any doubt that being actually connected to others and through singing with others has great benefits for people. Playing a musical instrument can improve breathing and also keep fingers supple. It can also reduce the risk of dementia. And visual arts practice can increase social engagement and people's psychological health and also self-esteem. Dancing can bolster cognitive and motor skills and lessen the likelihood of developing dementia later in life. Taking part in dance classes can promote greater flexibility, better cardiac functioning, muscle strength, resistance to osteoporosis, and lessening of joint and muscle pain. And of course, preventing falls amongst older people is a major focus for our NHS, and dance and movement has an obvious contribution to make here as well, for a relatively tiny amount of resource. So I'm keen to support as many arts and wellbeing initiatives as possible, as is the Arts Council of Wales. We and the Arts Council are holding discussions with health colleagues, and the Arts Council is looking to improve the evidence base on the effectiveness of such interventions. Hopefully, this can be the precursor to even more activity in this area. To finish, I'd like to thank the Arts Council of Wales again for arranging this excellent conference. It's a subject of immense importance to people and communities across the country. And I'd also like to thank the Baring Foundation for its generous grant, which has enabled this conference to take place. And indeed, thank you for your contributions and for coming to this event today. Diolch yn fawr iawn.
Hello, thank you so much, Ken. Thank you for locating the arts within government policy and legislation and the opportunity for the arts. Ken's kindly said that he's able to take any questions if you have any, or comments if you'd like to make them before we close. Yes, we have one here. We have the microphone.
I just want to make 2 points. First is, you know all the reasons why arts are so beneficial. Why do we have to bust a gut to produce this evidence over and over again, time and time again, which takes a lot of admin time? So that's just a moan. My second moan is that since 2012, over £1 million a year in arts funding has left mid-Wales, Rheda and Llanfindod Wales. And organisations have had to close, artists have left or turned to drink or had breakdowns. And I keep being told that what we've done for 30 years is really valuable, yet the services are being cut. So in your economy and infrastructure work, could we please have a bit more investment back into rural areas like Mid Wales, which have fewer votes and less influence, but nonetheless contain quite a lot of the population of Wales?
Can you respond very briefly to that?
Absolutely. I do think that there is recognition that we need to move towards more proactive spending rather than focus our precious resources on reactive spending, which is essentially treatment of illness. But it does require difficult choices to be made. These are choices that we are ready to make, but in the context of having our budget cut by £1 billion, it means that there is severe pressure, especially as spending on treatments has increased, there is severe pressure on other services. Notwithstanding that, what I've been looking at doing is levering in as many opportunities from across my portfolio to benefit arts activities. Not just so that arts activities take place, but crucially so that we get more people becoming active in the arts. If you have more people becoming active in the arts, you have more demand for arts organisations and arts activities to get a greater share of public resource. But you also have essentially more people who are willing to contribute to those activities. So my key objective is, and I've talked about it in the past, is to try to reach a position where Wales can genuinely claim to be the most active and artistic country in Europe, not just in terms of watching forms of activity and cultural practices, but actually being participants in those activities. And then I think we would see a massive cultural change, and we do need a massive cultural change across the Western world. If you look at how spending, or investment, I should say, in culture across much of the English-speaking capitalist economies of the Western world has gone in recent years, since 2008, pretty much everywhere. It's dropped. But what we need to do is recognize, and I think I take your point that you already know, I already know, the value of the arts in terms of preventing and treating illness, but there are still many people in society who see the provision of NHS reactive services as a priority, and for good reason, because often if you are involved in an accident or if you become ill, you look in the first instance for treatment. But there is still, I think, there is still a belief that spending needs to be pumped more and more and more into the reactive element and not so much into preventative care and preventative activities. But I do think that culture, that behaviour, that attitude is slowly shifting. And in terms of Mid-Wales, one of the challenges for Mid-Wales, and the reason that it's actually an important region to highlight right now, is that it's far more likely that people in rural parts of Wales will feel a sense of isolation. And as a consequence, we do need to develop not just an economic strategy, but all strategies across all departments in government and local government and across the third sector as well, that recognise the additional barriers that people in rural Wales face in being connected to others. If we can overcome the lack of opportunities and the barriers to being actually connected, because let's face it, in this day and age, we're often encouraged to believe that it's only important to be virtually connected. But if we can overcome the barriers to being actually connected by providing better bus services, for example, then we will again drive up the number of people who are active participants in the arts, thereby driving up the number of people who will shout for the arts and also invest in the arts. This is about getting everybody more active in the arts, and then the arts will become be seen as a more critical component of service provision in Wales. And that's where I want to get to, the point where people compare the arts to some of those other frontline services provided by the NHS as a critical component of our well-being.
Ken, that's really helpful. Thank you very much indeed.
Yeah, thank you.
I have known other parts of the UK where government ministers haven't always been quite so ready to stay for questions at the end of the speech, but there we go. Thank you very much indeed for that. It was a perfect way to close the day. And